Welcome to a special Best of Vet Care episode of Care Experts. We've put together the most popular and talked about episodes of the year. We'll be covering puppy vaccines and cat skin issues with Dr. Jeff Werber, dog food and diet with Dr. Andrew Moffatt, and kennel cough with Dr. Ayeley Okine. Let's dive in. So let's get right into it. What are dog vaccinations?
So vaccinations for dog or people, they're all the same. Basically, they are stimulators of the immune response, of the immune system. In dogs, for example, we have some that are we call attenuated or live vaccines. Those are made from the real disease that have been then passed on to different species. So they are no longer infective to the dog, but will stimulate the same immune response to protect the dog to develop its own antibodies against that particular disease.
And now, what are the core puppy vaccinations? I know we all have to take our cute little puppy in to get vaccinated. Which ones do they absolutely need to have?
So that really depends on two factors. Number one, location, where you live, and lifestyle. So for your standard dog in Los Angeles, for example, the dogs that I treat, I'd say the core vaccines are your distemper parvo combination. That's the DA2PP. You have Bordetella, and you have rabies. But now, because of a new disease that we're seeing a lot of, the influenza, a lot of locations that you might want to take your dog are requiring influenza. So in a sense, that might be becoming one of the core vaccines.
For those new pet parents who have just brought their new puppy home, what would a normal schedule for puppy vaccines look like?
The truth of the matter is, when a puppy is born under normal circumstances, let's not look at the abnormals. Normally, puppies nurse. In the first 24 to 36 hours of nursing, they get colostrum from the mom, which has all the antibodies they're going to need for at least 8 weeks, sometimes longer. It starts to wane a little bit, maybe 7 to 8 weeks.
Okay.
Now, what I see a lot of breeders doing, a lot of shelters doing, they're vaccinating puppies at 5 to 6 weeks of age. Okay, that is potentially dangerous. Why? Because again, let's think back. What is a vaccine? We talked about it. A vaccine is the antigen. It's the enemy. It's in an attenuated form, so it no longer can cause the disease. But mom's antibody, called passive antibody, because she gave them the antibody, they don't know that. They see this vaccine that you just gave it 5 weeks or 6 weeks. And they go, oh my God, it's a disease. And they go to attack it. And it's like the old Pac-Man game. You get one Pac-Man, and that's it, out of circulation. So when you give a vaccine too early, it uses up all of mom's passive immunity. Yet their own bodies aren't mature enough, their immune system, to start developing its own antibody. So now you're leaving the dog unprotected.
Thank you, doctor. Now let's join Dr. Andrew Moffatt for dog food and diet. First, let's talk about dog food. There are so many different types of dog food: wet food, dry food, fresh, raw. I mean, the list is endless. So what is best for our dogs?
Well, I think every pet is different in terms of their nutritional requirement and their preference in terms of the type of food, wet, dry. I think, again, I always direct people back to their local veterinarian to have that discussion following the wellness exam, so the vet can give you a recommendation on the best nutritional plan for that pet. So puppies and kittens are going to need a certain type of food. An adolescent and an adult will need a variation of that, and then a senior pet will need a different type of food as well as their lifestyle changes.
So what are the differences actually between puppy, adult, mature dog foods? What are those differences?
Yeah, so it's all about the balance of energy, protein, fats and carbohydrates for the different growth stages of that pet. So in a young growing puppy, they're going to need higher levels of protein. They're going to need an appropriate balance of calcium and phosphorus for bone formation and things like that. An older pet may need a lower calorie food to help manage weight gain associated with a slowing metabolism. I'm finding that myself a bit these days. But also they're going to need support for like arthritis and deteriorating skin quality, not dissimilar to humans. So we do want to be making sure we feed the right food for the lifestyle of the pet. exactly the form of that, wet, dry. From a nutritional standpoint, it doesn't really make a difference. There are great wet foods, there are great dry foods, there are poorer quality wet and dry foods. It's all about finding the food that works best for your pet. From a nutritional standpoint, you want to make sure they like it and they eat it, their stools are maintained, and you always want to try and provide your pet with the best food that you can afford. Like all things in life, typically the more expensive the food, the higher quality, although that's not always the case. And so I think, trying to find a reputable food through the recommendation of a veterinarian or your local veterinarian is a great place to start.
So tell me, if I'm making a steak at home, let's say, and well, there happened to be some left over, what is safe to feed our dogs at home if we want to give them some table scraps or a little human food treat? Are there any big no-nos, things that we should not give our dogs?
Good question. So, it is nice to feed your pet a treat, and the love they give you through that treat. My cat is very food motivated. She'll do anything for a piece of chicken, a slice of cheese. But not uncommonly, after I give her something like that, she's then got loose stools for a few days. So our bacterial flora gets used to a particular diet. When we change that up, we are at risk of upsetting our bacterial flora. Certainly, giving dogs treats with high fat content can upset the gut, can cause things like pancreatitis. So we're always cautious with recommending treats. Really, to keep your pet in its optimum health, feeding them a consistent diet constantly is the way to go.
Thank you.
It's time to talk kennel cough in dogs with Dr. Ayeley Okine.
So Dr. Okine, can you start by just telling us what is kennel cough?
So kennel cough we tend to associate more with Bordetella, but it's actually a collection of diseases, upper respiratory diseases that we can see in dogs. So it's not just Bordetella. There's a number of other viruses and bacteria that can make it up, but we traditionally think about it as an infectious upper respiratory condition.
That's very scary sounding. So an upper respiratory condition that includes Bordetella, but could be other diseases as well.
Correct.
How do our dogs get kennel cough?
So they get it from other pets. So we traditionally think about it as being something that they pick up in a kennel, but any boarding facility, they can pick it up from, doggy daycare, they can pick it up from, dogs passing each other on a walk. Any pet that is ill with one of these infectious agents can spread it to other pets quite easily. And we can even transmit it on our clothes. If pets share water bowls, that can transmit it as well. So it really is quite contagious.
So kennel cough obviously can be very contagious, and we see different symptoms with it. When should I bring my dog into the vet when I'm concerned about kennel cough?
So if you're concerned at all, go to the vet. I always tell people, I'm concerned if you're concerned. The big things to keep an eye out for are if your pet is bringing up any material when they cough, if they're having labored breathing or seem like they can't catch their breath, if they have a fever. So some people will have thermometers to be able to check either the ones for the ear, you can even check a rectal temperature at home. If they feel hot, sometimes people are good at being able to pick that up. If they're not eating or drinking, if they're having a lot of discharge from their eyes or nose where you're having to wipe it away, every couple of hours, those would be signs that I would say, is this a complicated infection? Do they have pneumonia? Is it something else going on? But bottom line is, if you're concerned, I'm concerned, and go to the vet.
If you're concerned, get them into the vet.
Yes.
It's the only way to really alleviate your stress, and they'll tell you what's going on.
Correct, and then you don't have to guess about it, then you know.
Great, well, thank you so much. These are very informative questions. It's always so scary when our dogs develop a cough, so it's really nice to know, take them into the vet and what our possible options are to help our family members out.
Now back to Dr. Jeff Werber for questions about cat skin issues.
So tell us, what are the most common skin issues in cats?
When it comes to cats, I think the most common is what we call miliary dermatitis. The problem with cats is, let's go backwards to a dog. Depending on where on the body a particular dog problem is, whether it's lower back, whether it's underneath, whether it's face and ears, you kind of have an idea what it is. Cats aren't so nice to us. In other words, if lower back in a dog, you think fleas. Underneath the groin, you think atopy, which is atopic or inhaled allergens. Ears could be overlapping, chewing at the front feet, rubbing the face, you think food allergy. With cat, it's a free range. Anything, any location on the body could be a problem. And they also have certain things called a eosinophilic granuloma complex, which is it's an immune-mediated condition where they will get areas of scabs around the neck and the face, rodent ulcer, linear granuloma. These are all problems that are responsive to steroids. So the good news is that even though you may not be able to know what the source of the allergen is, cats do better than dogs when it comes to treatment.
How do I know the difference? Let's say I'm petting my cat and I feel like a lump or a bump. How do I know what it is? Is it a tumor? Is it just a bump? Is it a lump? How do we know?
When you're petting and see a lump, I would recommend all lumps being checked by a veterinarian. It could be a wart. It could be a cyst, benign, both of those. It could be an early type of cancer. If it's here in the neck, it could be a lymph node. So don't ignore any lumps or bumps.
The big question, should I bathe my cat?
So yes and no. How'd you like that for an answer? All right. Cats often need bathing. If they're having a skin problem, if they have secondary skin infection, if they have dry, flaky skin, baths could help. Now, is it easy to bathe a cat? Not so easy. Now, some do great, but some just do not like water. And just because they groom themselves, that's not enough of a solution. So you may need the help of a professional, your veterinarian, or a professional groomer that is comfortable with bathing cats. What I recommend, however, is when you get a young cat, you have a kitty, get them start using do it in the kitchen sink. Just let water run very lightly on them, and just lather gently, soap them up. Just don't freak them out. What I recommend also, you've heard of the term scruffing a cat. Mm-hmm. All right, when you are bathing a cat, as long as you always keep a hand on that scruff, they seem to be more receptive to being bathed. But if you take your hand off that cat, you're now chasing the cat down the hall because that cat's out of there.
The wet cat down the hall.
The wet cat, sopping wet, right.
Thanks for joining us for this special Best of Vet Care episode of Care Experts. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.